Autism spectrum disorder in the lifespan development domain. Autism spectrum disorder is a neurodevelopmental disorder characterized by difficulties in communicating and interacting in a variety of social contexts, restricted and repetitive behaviors, and early onset of symptoms that ultimately cause clinically significant impairment in everyday functioning. A reliable diagnosis of autism spectrum disorder may be made as early as age 2, although symptoms may be noted before 12 months of age, depending on the severity of the symptoms. Autism spectrum disorder is a term used to diagnose disorders that were previously classified separately, including autism, Asperger's syndrome, pervasive developmental disorder (NOS), and childhood disintegrative disorder. The term spectrum is used to reflect a wide range of manifestations of the disorder that are determined by developmental level, chronological age, and severity of autistic condition. The Embedded Figures Test, the EFT, may be used as a tool to test for autism spectrum disorder, as people diagnosed with the disorder tend to score higher than the average population. The cause of autism spectrum disorder has been related to genetic factors. However, it appears that genetics may simply represent a predisposition, making some children more vulnerable to the effects of environment, which may trigger autism spectrum disorder. The exact cause of autism spectrum disorder remains unknown at this time. Heritability estimates for autism spectrum disorder have ranged from about 37% to higher than 90%, and approximately 15% of cases appear associated with known genetic mutations. The best established prognostic factors for autism spectrum disorder are the presence or absence of associated intellectual disability and language impairments, as well as additional mental health problems. A comorbid diagnosis of epilepsy increases the risk for intellectual disability and also for lower verbal ability. A comorbid diagnosis of epilepsy increases the risk for intellectual disability and also lower verbal ability. In treatment, the first 4 years of a child's life are critical. During these years, children are still learning language and their brains are in an early stage of development. The best form of treatment is behavior therapy accompanied with one-on-one attention. In this therapy, children are praised and rewarded immediately after learning appropriate behaviors, such as direct eye contact during play. Learning language appears to be a key factor for children combating autism spectrum disorder. With therapy, children may be able to learn how to communicate meaningfully and act in socially appropriate ways. They may also have a chance to grow to have a normal life. Let's practice with a question for autism spectrum disorder in the lifespan domain. While the exact cause of autism spectrum disorder remains unknown, research has provided strong evidence that Answer A, genetics play a significant role in the development of autism spectrum disorder. Answer B, environmental factors play a significant role in the development of autism spectrum disorder. Answer C, trauma before, during, or after birth plays a significant role in the development of this disorder. Or Answer D, exposure to toxins play a significant role in the development of autism spectrum disorder. Answer A is the correct answer. The cause of autism spectrum disorder has been related to genetic factors. However, it appears that genetics may simply make some children more vulnerable and predisposed to the effects of the environment. And as a result, this may trigger autism spectrum disorder. We invite you to participate in the next chapter of our series on the key term areas affected by the DSM-5. Thanks for joining us.